Good afternoon, everybody. I'm Brooke Lovelace with the Iowa Developmental Disabilities Council. Thanks so much for joining us today. We are super excited to be offering this Take Charge of Your Healthcare webinar. It's been something that we've been working on for a couple of years, so we're glad to see it up and running and ready to go. Just a couple of housekeeping things. This is the first of 4 webinars. So if you're only signed up for this one, go ahead and get signed up for the other 3, and I'll put that registration link in the chat for you. But we do hope that you guys are able to join us for our other 3 that we have. We do have interpreters spotlighted, so hopefully you can see those. You should be able to access the closed captioning on the bottom. You can either, on mine it says show captions, but you may have to hit more to get that feature. So again, thanks for joining us today. I am now going to turn it over to Tammy, who's going to get us started today. Welcome, everybody.
Hello, everybody, and I will echo Brooke's welcome. We are really excited. We've been working hard on these presentations, and just to let you know, as Brooke said, we are doing this on the webinar for the first time today. So we practice sometimes, but this is our first presentation, so give us a break. I think we'll be okay. We are asking you is keep your microphones off unless you're talking. We might be reaching out to some people to help us a little bit during this, and we'll ask you to unmute then. You can sure leave your cameras off. And if something goes wrong and you need help, you can write a note in the chat and we'll try to figure that out with you. We are recording the presentation, and so if you want to watch it again or share it with somebody, the recording should be available in a few days. We are very excited to be here. We are going to do something a little bit different today that we want you to try with us. It's called Slido. Next slide, Lori. So this is a way for you to help participate with us, and you need to get your phone and hold it up to this code, and you'll get a link to a website or an app. It's called Slido. You get the link to that app, and then when we ask a question during the presentation, you'll get to type your answers in the phone, okay? And then your answers will appear on the screen. You may have used these in other meetings before. So if you take a picture of this QR code, your phone will download this app, and then when we ask a question, you'll be able to type in. If you can't get that done or you don't have your phone or something, you can also put your answers to those questions in the chat, and we'll be checking that out. So there will be time at the end for some questions and comments. And I think, again, we're excited to be here, and I am going to introduce the stars of the show, Dayreen, Edward, and Lori. Go ahead and introduce yourselves, guys, and take it away.
Hi, my name is Dayreen. I'm an outreach coordinator, and I'm also a mom of a young adult with a profound nonverbal autism.
I am Edward. I am the self-advocate coordinator, and I'm also a person with a disability.
Hi, I'm Lori Scheidler, and I'm program coordinator here at the USUD and a mother of a son, teenager with autism and ADHD. And I want to thank everyone for joining us. And I'd also like to introduce someone else who's behind the scenes with me here, Andrea Pooley, who helps us with our technology.
Hi, nice to meet everyone. Thank you for coming.
It takes a village to do this, so let's get going. Thank you, everybody.
Thank you. So today, the goal for today is what is ADA? What is the self-advocate? Ways to be a self-advocate, making a doctor appointment, and talking with my doctor.
So we do have a slide again. What does this mean to be a self-advocate?
That's a good question. Could you help us and participate at this moment in the Slido? And
Speak
speak out.
up for us. Speak up for yourself.
Say, what do you think?
Big webs. I like to big webs though. Don't you?
Yes. What else?
Asking for what you want.
Knowing my rights.
That's isn't what we are gonna talk about. Ourselves.
Speak up.
It's okay. Pick up for the biggest one and they're all over them. Wow.
That's good. Good answers.
Um, being a self-advocate means having your voice is hard. No, say yes or no question. Know your rights, as you guys have mentioned that. Ask for help and ask for what you want and need. Be treated with dignity and respect as and treat others with the same way you want to be treated. And live independent in the set up your goals to be independent in your own way. That's more important and feel
It is important.
next.
Next.
And then the next title is why is this important to be a self-advocate?
Again, please participate in Slido and write it down and let us know why it's important. That's all right.
Not your voice is hard. Basic.
Your needs met.
You need a man. That's good. That's a Friday weekend. See one.
Yeah, it is.
And this is so interesting because sometimes guessing what you need is a creature.
Yeah.
Not like um asking for help is one of those. Hang out with who you want to hang out with. Asking question work where you want to work is that's one of the process I continue to see a lot of us struggle with. But we overcome those challenges and we know that we can be better at working where we want to work.
Yes.
Buying what you want to buy.
I can buy whatever I want to buy.
Yeah, you can. If you get the money.
Oh, if I have my money, okay, if I have
If you have a
a
job,
budget, if I have a job, yeah,
you're the best position for you.
that's good. That's very important.
Work for who you want to work for. But sometimes we don't get what we want. And the only way to keep on to get what we want, we can be advocates for ourselves. That is working.
So that means the first time I don't gonna get whatever I want to
Yeah,
get.
but you keep on moving forward or you keep on advocating.
Yeah, that's really, thank you. Thank you. That's a really good explanation.
When and you were to be a self-advocate.
That's a good question too.
I the doctor's office, like when I go to my doctor, I sometimes need to find that place where I'm going. So that is where in the community when I'm at home, I sometimes can trust my people at home. My dad as an example.
So
I on the bus and with family member or friend. I being a self-advocate is to act for accommodation.
That's very important.
Next
So-
page.
As talking about to being a self-advocate, we also have something they call the ADA. ADA stands for American with Disabilities Act. This is a federal law to protect Americans with disabilities from discrimination. It helps to remove barriers and so they can participate in the communities. So Ed, when we talk about barriers, what comes to your mind? What is a barrier?
A barrier is something that I cannot do, right? Like, as you know, one of the barriers that I face as to work may be reading and writing,
Reading and writing?
but because I cannot read, so I'm not depend on someone or using technology to help me out with reading.
Yeah, that's a good example. So a barrier is an obstacle or a challenge that can prevent you to access to healthcare. So that's a really good help. So with that, we also, as you was mentioned, to be a good self-advocate, sometimes we need to get some accommodations to access better appointments and so we all have rights to be an equal to healthcare. An accommodation is a tool, service, or a way to doing things that can help a person with disabilities to complete their tasks. The doctors may need to provide you with accommodations. So people with disabilities who speak other language, they can get an equal access. So that's really important. As you was mentioned about it, that being a self-advocate, sometimes we have to let people know what is the accommodation they're gonna need, because maybe it's different from somebody else too.
Yeah, it's when you meet one person who needs accommodation, you kind of see that one person with that accommodation.
That's very important. Actually, that talks to me because having being a mom with a son with autism is individual from other person that has autism. So accommodation, it has to be specified for the individual needs.
Yeah.
So now we're gonna have another question. What are some accommodation that you may ask for? So let's see if you can help us and see what accommodations that you ask, or maybe you need to ask interpreter. Yeah,
Time, help reading.
more time, that's really important. Time, helping with reading,
Um,
doctor recommendations and writing, that's really good.
that's the good one, right?
Yeah, they are doing really well, actually.
Um,
Clear directions is really important too.
another someone who says we need someone to read for us. And so
Yes.
those are some of the topics we're gonna talk about.
Yeah, we're gonna ask someone if can participate and help us now to help us to read this slide. If anyone,
I will.
thank you.
Hello. Healthcare rights and responsibilities. Rights. Choose a provider or clinic. Be treated with respect. Bring a support person. Receive the accommodations that you need. Have the doctor explain things so you can understand. Responsibilities. Be on time for appointments. Call in advance to cancel or if you will be late. Give accurate information to your doctor. Follow your doctor's directions. Use urgent care and emergency services appropriately.
Thank you, Leah. So as you see, the rights is to be treated with respect, but also bring a support person. A support person could be like a social worker, you a caregiver, or a good friend, or someone that you trust. Who just you have a support person?
Yes, I do, and there's a pair, and my dad is one with them. What about you, Dia? Can you unmute yourself and tell us what is the most important part of this that stuck with you?
Leah?
What was the question?
What is the most important part of this that stuck with you?
My screen keeps freezing on me.
From
Can
the
you
rights and responsibilities, what do you think is the something that
Is the most important?
important to you?
For me, being treated with respect is the most important. You can tell if somebody doesn't care what you have to say or isn't listening, and that just turns me off from wanting to come back or to speak up about what I need.
Yeah, thank you. That's right.
That's one of the most important thing to everybody. Regardless of whether you have a disability or not, you should be treated the same way as you want to be treated. And that's the part of the golden rule. Thank you, Zia.
Thank you. As we mentioned, the rights and responsibilities, but we also have responsibilities, and one is kind of like really important to me is be on time for my appointments and call in advance if I'm gonna be late. So I don't know why, but I always running and rushing into places. But now talking about some of the accommodations and rights and responsibilities, now we're gonna talk about when we need to find a new doctor.
So we when we now we're going to talk about finding a new doctor and how we use our voice to find the doctor we need to be successful. And that takes us to the next page.
Yes.
You may be a voice finding a doctor, securing doctor, if the doctor move away, or if the doctor has moved or you have moved. If the doctor sets up the appointment, a long appointment for you guys, then that's the time I feel like we can find a new doctor. When they talk things or they see us once a year, then we should fire them and find a new one. The other important thing here is how does the doctor feel working with you? How do they respect you? And do they talk to you? Those are some of the things which we know are important to us as people with disability or as people in general. So we should treat each other the same way as we should give each other the opportunity to look for a new doctor. And that's what we will talk about more in detail.
Yes, it's really hard. It changes our heart sometimes. Finding a new doctor is something that kind of like talks to me because now my son is an adult and I have to finding a new doctor for that reason. And how to finding a new doctor is the question. Is you can ask a friend about any good doctors that they know. You can ask your former doctor, and you can also call the insurance company and visit their website because not all places will take your insurance. So it's really good to call in advance.
When someone cannot, so I go back to the back to the other side of the lorry. I would think that sometime we can also ask family member is very important. Other than we are the located, but also we are the art. Sometimes it's very important, and that can lead us to the next page.
Yes.
So when you're choosing a new doctor, you need things to think about when you're choosing a new doctor. This can is the gender of the doctor important? Is the doctor's office located in the right place? Is it close to me? Am I gonna be able to get the accommodation I need to be able to do a successful appointment? Wheelchair accessible, language interpreter. That one is more important to me.
And to
As-
me too, believe me.
As someone who we speak a different languages, we know how hard it is. And so having the different languages, they win. Can you talk about more about that?
I think it's really important to when you go and understanding the treatments in your own language, it makes a huge difference. So I always asking for a translation in Spanish.
That's the other important thing is waiting, private waiting space. I know that is more important for me. I sometimes think about when the doctor comes in to talk to me, I want people who I don't know to listen to my conversation with the doctor. So I would want a space for me. And that is the more important too. Next page.
So now that we've been talking about finding a new doctor, now we're gonna talk about me and my doctor.
Can I have someone with this for us?
And anyone can volunteer and read it for us and help us.
Ken, this is Maggie.
Thank you.
So when you're making an appointment, find a time that works for both you and your doctor. Know where your doctor is located. Let your doctor know if you need language services, and ensure the doctor's office is accessible and that they can accommodate your needs.
Wow, that's a good one. We don't, I don't think about accommodation until I get to the doctor's office when I make appointments. Unfortunately, so for someone who thinks ahead, what does the doctor gonna do? Is to think about making an appointment with them. It's to call them and let them know that who they can be, and that's sometimes help us to know. For example, if I was using a language services, I may call him, hey, can I get the interpreter to come and help me out with my communication barrier? That sometimes happen to be, and sometimes those guys will give you the time to speak up. Sometimes they don't have time. So it's always good to know what appointments you have to go through. So
Yeah, and having the time that work for the doctor and for you, or for it, that could be really hard sometimes. But especially if how far or if you get closer to the clinic where the doctor is.
oh yeah. That's right. Oh, good that we know when we need the doctor when to speak up or we within the outside office sometimes. And sometimes we can be, when we set up appointments, we can call to find out whether we can get those accommodations.
Yeah.
Now we are going to talk about finding transportation and going to get to our appointment. For many of us students, the bus, how for me, I use the bus to get around. So I will say that the thing I need to think about when using the transportation, when it gets into my appointment, I need to think about how am I gonna pay for it? Or how am I gonna use the bus pass? Am I gonna drive? Or if I do those things, can I get a seat? Am I scheduled this ahead of time? Those are some of the things that I think about when and I also when I come with someone, I think gonna be able to find parking for the car. And that's some of the stuff we think about when we are looking for when we consider looking for new doctor.
Amen. So here's the support person again. The support person is a person, someone that you feel safe or you can trust. That can be there with you, support you with the person that can help with transportation or your questions that you have for the doctor, taking notes during the doctor visit. Not everyone will need a support person, but remember, the support person is not there for making the decisions for you, is to just support you and help you to work together with the doctor.
Also, I can work with the support person to go to my appointment.
Yes, you can become an agreement and say how that person will help you, if it's gonna take a note or review after the appointment with the doctor.
Oh, that's too missing. About bringing you one.
Okay.
Next time.
What I should bring to my appointments? Well, what I need is a health insurance card, a support person, if you need one, also a photo ID, list of medications, which is really important for the doctor to know what medications you are. And also my profile card, which we're gonna talk about that and learning more about. My profile card has information to help the healthcare team. Has a picture of me and also have the name and the birthday and what I like people call me and things that I don't like and what things that make me more comfortable. So I think next is gonna be yeah, this is an example of my profile card, which I have one and we have there if you identify, here is my name is Dairi and I go by Dairi, so I don't change. But my son has also my profile card and his name is Javes, but he go by JB. And so his name is Javes, and then next is how we call him, JB. And also here I put some of the things that I will like to consider for me. I put the date and the month and the date, but if you see it, I don't put the year, so that way nobody know when I born. So, but I also put here, I need people to talk to me slowly, that way I can better understand, and using a plain language, which that makes really better for me. And I need a translator and I need extra time with my doctor. So that's things that that I will like to consider, and I take it to my healthcare provider. And also I put here, I don't like needles. And so you can put things that you don't like.
Oh, the needle are hot.
But sometimes you need to, that you need to let the doctor do it too and help you to, because with needles, we have the vaccines and the blood test. So even we don't like it, but we're gonna just let the doctor know.
You just need to trust the doctor how
Ye-
it feel.
Yes.
Next, speaking of, can I get someone with this? Another person.
And can you help us?
I can
And-
help. This is Ann Busta. Speaking up with your doctor. Remember, you are in charge of your body. Talk to your doctor about your concerns or any changes in your health. Ask questions to make sure you understand what the doctor is saying. Review with your doctor what you discussed before you leave. Check with your support person if you brought someone.
Yeah, and especially you know your body the best is the most important thing. And so when you know your body the best, you kind of speak up about your own body, and then you can add on to that.
Yeah.
I have a question for you, and what is one of the most important things here that you see for your own for yourself that is true that for you? What's one thing that true that for you from this page?
For me, I like to review with my doctor just to make sure I understood everything that she has told me and that we've discussed.
I think that's important when you can sit with the also your staff person and go through this or not that this is of the appointment. I know when I had a big appointment, where I had to see I have my health, I had to do the same thing. I had to sit with my staff person and tell them can explain to me what is going on. So they were able to speak to me as well as the doctor, because the doctor gave me a lot of information and I didn't know what to do with this information. So having him explain to me what was going on, I was able to calm down and reset my mind, and again the doctor was able to do to the great job of explaining everything the way they have to go and what they're gonna do and what they're gonna see what they see. So in some appointments you're gonna see that happen where the doctor wants they may not have time. It is important that you tell them I need extra time, and they can help you out with that too.
Yes.
Like, so we are not gonna talk about what a successful appointment look like. You go there on time. That's one of the things we struggle with.
Yeah, I struggle a lot with that.
I spoke that I spoke up about my concern. That's one of the things that those are sometimes kind of know that you ask your question to them, you know that you make your concern.
Yeah, the concerns that we have.
Did the doctor listen to your need? Did you focus? Did you focus? And did the doctor treat you with respect? Your accommodation are met. Your do you need what? Did you get what you needed? At that appointment, those are some of the things we should always think about in the successful appointment. Next.
Next. So here again, we have a success appointment. This is an example for Mike. Mike has sore throat and has going to the doctor. He requests a longer appointment, requests need to the forms to send him to him ahead of time. Meet with his support person before, ask the doctor to speak up directly to him, and programming all the questions in his communication device, and ask at the end of the appointment, Mike asked the doctor to email him the summary of his visit and set up the next appointment. I think this is really important to remind ourselves that the support person is there, but not the one who's gonna do the
We're not
make the
deciding for
decisions.
you.
Yeah, not the one who's gonna make the decisions, but it's the person that's gonna help you. And I have personal experience with this about when I go to take my son to the doctor because he's nonverbal. A lot of the times the doctor just directly to me and talk to me, and I say, no, I'm here for my son, JB. And so I like all the doctors and nurses to interact with my son, and not necessarily all the time with me. So this is how the success appointment look, and this is just an example of what we need to always be a self-advocate for ourselves and advocate.
And I think that those when you look at the successful appointment, one of the things we talk about is not only being on time, but meeting those requirements as well. And like you said, sometimes the accommodation we need maybe part of that package.
And especially with, like I say, my son has a communication device. It will take longer time for him to respond and to communicate some questions, and even that is still gonna be really struggle for him. So having asking for accommodation of longer time with the doctor to have a success appointment, which is okay.
It's how your kids spend time with your doctor, even though you are non-verbal.
Yes.
The doctor will understand when they look at you, your excitement, but when they don't seem to understand your body language, they can still engage you in that discussion.
Yes, you're right. So what did we learn? We learned what it means to be a self-advocate.
That why that's important to be a self-advocate.
Ways to be a self-advocate.
This is be self-advocate.
Your healthcare rights and responsibilities.
My profile card.
Knowing how to make an appointment.
How to choose a new doctor.
So, thank you very much.
Do you guys have comment question for us?
Thank you, Dayreen and Edward. You did a great job, and thanks for all your participation to the audience members. We have now some time for comments and questions. You can raise your hand or type in the chat. And I am interested really in what did you learn today and what can you take away? Anybody?
Oh, what the heck calling you?
Oh, come on. Does anybody have any comments or questions?
I have a question for the group.
Okay.
What was your favorite part of this? I liked listening to Ed and Dayreen talk to each other. That made it kind of informal for me and relaxing.
Great. We do too. We like that too. We have some people sharing in the chat. Helping, this is from Lee, enjoy helping our DSPs learn how to support and let the client lead. And another one from Maggie, appreciate hearing from both Dayreen and Ed from their experiences.
Yeah, the one up there, when we are in the charge of ourselves, sometimes we come to know who we are as people, because we come to be leaders in our community when we do that. So it's really about you standing up for your right and knowing that you have a responsibility.
Yeah. Edward, we have somebody with a raised hand. Kimberly, go ahead and unmute yourself and share with us. Kimberly?
I cannot.
Oh, we can't hear you, Kimberly. I think Danielle also has the raised hand.
I just wanted to add a quick comment that I really liked. What I learned or what I liked was at the speaking up with your doctor slide, and remembering it's your body, it's your body and it's your health. And so reminding yourself that even though doctors, are very well educated and have good thoughts for you, they don't know the whole you always. And so I think that was a really important point that you brought up, that it's still your body, your choice.
Boy, good one. Thank you.
Yeah, that's one of the other point that is very important as a self-advocate. You are the boss. You are the boss or the leader. You can make the decision according to what the doctor may recommend to do with your body, especially when it's in your body. You kind of need to tell the doctor, hey, this is in my body. Don't do anything that I don't want. And so
That's another
it's just
question.
important as well as it can be. Look,
Great job, guys. I think this was, I really also agree that I like the kind of conversational thing you guys did back and forth. Can you talk a little bit about the profile card? Is that something that's one of the resources that we'll send to, like, an example for everybody afterwards that they can fill out on their own?
Yes, we have, if you, I'm gonna send.
Yes.
We can send, yeah, it's just a picture, small picture, and then actually these also, I don't know if we have the, there, because in the back of the card, we have like some kind of like suggestions that people can see it and ideas, what do you can put in the front, like things that you don't like or things, because mine gonna be different from my son as nonverbal, so I'm gonna put here, he's gonna need more time, please give him extra time to respond with his communication device. Or he don't like waiting too long, so I'm gonna need to have a space where I can take him. That be one of his accommodations. I also can put it here and this card. And you can take it to your healthcare, any other appointments we do, healthcare team.
And to answer your question, Brooke, we are going to send out a version of that card with the tape link and those kinds of things. So you'll get your own version of that to print off and use. Kimberly says in the chat that she's back on now. She got cut off just as she was trying to speak before. So Kimberly?
All right, can you guys hear me now?
Yes.
Okay. I apologize for that. No, touching base with my profile card. My son is 13 and he's verbal, but just intelligible. And we've been working on advocating of him saying his name, his birth date, everything else. So I think with his assisted or his AAC device. Though he's a little resistant because he's like, no, I don't want to use that. But I'm thinking my profile card could be perfect. Like, okay, you can use this one or that one to still keep working on those advocacy skills. Touch on that. But I said, so this morning I am part of the USAID in South Dakota and one of the LEN trainees for that program. And so this morning I'm actually taking part in a transition clinic with a 16-year-old and comparing the two of these and promoting that self-advocacy piece is really tying in with what they are showing with the client or the patient today. But you have provided more points of why we want to have the self-advocacy and what they can do, what you need to do for yourself. So very, very good information being provided.
Thank you so much, Kimberly. Thanks for joining us.
No question.
We have well, we have a couple other comments in the chat. One is that this My Profile card could be something that we give out or we encourage doctors' offices to offer to their patients so that they can ask for this information from their patients as opposed to the patients always having to bring them in. And it just gets it out there more. So that's really a good one. Thank you, Anne Crotty. And then let's see. Let's see, what else we have? We have Lee at saying complimenting every bit of you on your experience and on your presentation. And I think I'm catching everybody. I'm kind of scrolling through my chat. So Danielle says, wonderful idea, helps facilities become more proactive. Yes, and we've talked about My Profile card in that way also at IWAS, you said. So. Well, I think we can go on to the next slide. We can still take questions or comments in the chat, but just to continue, we have upcoming webinars, as Brooke mentioned in the beginning. And this, I think that she put in the chat the link to sign up for these because you do have to register. But on November 20th, next Wednesday, we have a presentation called Healthy Choices. Then we skip Thanksgiving week, and the week in December 4th, we have Going to the Doctor, and December 11th is Getting the Care You Need. So those are the 3 remaining webinars that we have, and we really would invite you to come and share this with others that might need to hear this message also. Next slide. This is the contact information for the stars of our show, Edward S. Beck, Dareen Levan, and Lori Schneidler, who is the brains behind the scene. And we also have a survey to get your responses to this session, get your feedback on it. It is a Qualtrics survey. You can take a picture of that QR code. I think that the survey link was just put in our chat. And so please do that. We'll also send out the link when we send out the information later this week. And last slide, acknowledgement of this presentation. We developed these with help, or not help, but it was inspired by our presentations and tools from the Oregon University Center for Excellence. And we created the slides here in collaboration with our USAID and our On Track grant and the DD Council. And just to highlight this information is for personal use. It's for your use, general use. It's not medical advice, and it's not addressing any individual situations. We talked about things that come up for people today, but this is just general information. So anything else to add? If anybody, any other comments?
I have something.
Go, Anne.
I think it's important to acknowledge that there's all this effort that's in this project is targeting people with disabilities themselves, but we also need to recognize that there's an entire other side of this. People or healthcare providers and the healthcare system needs to be targeted too. I know On Track is ending, but we need to really think about what we can do and how we can continue the work of educating providers and systems to be more inclusive of people with disabilities so that they don't have to do as much advocating into a void, you know.
Yes. Thank you. Thank you, Anne. That is a good idea. And then your comment about the My Profile cards getting out there is a good idea. Good thought. Judy?
Well, I'm going to coattail off Dr. Crotty and just say that if we all wanted to begin to make this change, we would all get the profile card and begin to walk into our doctors with them. We can do it one person at a time, whether we have a disability or not, because I don't think anything that Ed, you and Dayreen talked about today are not things that I struggle with, and that things that many populations, whether it is youth, women, people with disabilities, senior citizens, we all need this kind of information and the ability to advocate for ourselves. So I think, I guess I'd like to challenge all of us to try it. And if it's a bad idea, then we come back and say, bad idea, Ed and Dayreen, throw them under the bus. But if it does help, that we could change it one person at a time, I guess is what I'm thinking.
Great comment, Judy. Great comment.
Yeah, and I think we need to have a continued conversation about that, like at the individual level, and our roles as in the healthcare system of how can we pull the levers that will help speed that process up too.
Yep.
Let's keep talking on that.
Changes.
Is one of that.
Great comments, everybody. And that is a good idea. Both you, Ann and Judy, just taking them to your doctor and having the doctor say, oh, where'd you get this? This was really helpful. And then they want to know how they can get some more of them, and just sort of groundswell of support.
The question is, how can we reach it to the people who might never did something like this? That's the question you can ask ourselves.
Right. There's another comment in the chat. I think putting ourselves into it is like the first layer that normalizes it for our clients. So I think saying that if you do it, it normalizes it for other people, and as support staff or as social workers or case workers, that type of thing, doing it for themselves helps normalize it for your clients. Yep. And as I said, you will get a fillable version of that in the stuff we send out. So it's a PDF version that you can print off and fill in the accommodation needs and have one for yourself.
And if I could just add too, if you enjoyed today and want to see more of Edward and Darwin, I think that you should tell your friends, bring a friend to the next one on the 20th and the other dates too. So do share these links and get more people to hear this information. I think that would help too.
Gosh, Tammy, do you suppose if we brought a friend with a disability, you could give us a prize? Just say,
Oh, I could
Well,
certainly share kudos.
We might have a make your mark to get go bag that we can send out to people.
Yeah, okay.
Yep.
So if I bring 10 people, I get 10 bags, right?
Yes, Judy, yes.
One for each of your friends. You have 10 friends, Judy? Oh, I didn't think so.
If I tell them there's a bag in the deal, Tammy, I might get.
Yeah. Yeah. Yeah, right. Well, anyway, you guys, we're starting to digress here. So thank you for coming. And please do use the links, or you could go to the DD Council website and other places to get that if you missed the link in the chat. And we could send it out again when we send out this stuff, make sure people get it. So thank you again. Thank you again.
See you
Thanks,
next week.
everyone.